Hi everyone, welcome to ResearchMD.com. Dr. Pramil is here. I'm a Chief Medical Officer in the United States, also an Associate Professor of Medicine in one of the largest medical schools. Now, we've been doing a series of lectures on physician mistakes. Okay, we're going to talk about another important common physician mistakes. And this Guillain-Barré syndrome, and resulted recently $85 million worth of lawsuit was filed. Okay. Now, when we physicians are humans. We are going to make mistakes. Okay. Once we make a mistake, the impact is on huge emotional impact. That's what we're going to get first, right? You're going to think about it. Oh my God, I went to medical school, and then I can't help a patient. I made a deadly mistake. That's going to stay. You can't sleep. But next thing also we need to know, the lawyer's going to come after us. Okay, with the vengeance. Depends upon the age of the patient. So you have to be extremely careful what's going on. Once the lawyers come in, all your money is gone. Okay. A lot of people kind of ask me, doctor, what happens? I have insurance. Why should I worry? My friend, look at your contract and see. Most of this insurance, there's the limit they cover, 3 million or 4 million per occurrence. Nobody is going to cover. In this case, what happened? 85 million. Who's going to pay about that? Think about it, okay? So we're going to talk about Guillain-Barré syndrome. Mortality rate is extremely high. The usual presentation is patients come with the lower extremity weakness, kind of spread upper extremity. Think about, the weakness, okay? Lower extremity and upper extremity, usually symmetrical, okay? You can have foot drop. But before you go into, so when a patient comes in with the lower extremities, what the doctors usually do is that they think about stroke. They get a CT and MRI and discharge the patient and saying hey, get him some physical therapy. I have seen that, okay? The first thing you have to do, get a good history. Now, I remember seeing a patient, I diagnosed, this patient was same thing, came to to the hospital, and lower extremity weakness. So nobody, they did a CT MRI and said send him to rehab. So I was actually working in one of the rehab hospital, and I was kind of going through the proper history. And this person, what happened was he had Guillain-Barré, and he had, when I get his history, I went into the sexual history and got his sexual history, multiple sexual partners, and then of course did an HIV test on this guy. HIV was positive. Okay, so we were able to save the patient. So it's very, very important to go back and get the history. Usual presentation, people can have upper respiratory symptoms before, and then also you can have diarrhea caused by Campylobacter jejuni. Okay, and then the symptoms start slowly develop. Usually, it's slowly, sometimes it can last 2 to 4 weeks, and then permanent paralysis, even death could happen. Mortality rate is almost up to close to 10%. Let's consider that, okay? So we have this, the symptom, the clinical features, again, weakness. We talk about the upper and lower extremities, symmetrical, my friend. Respiratory muscle weakness, so that's why we do this pulmonary function test. Nerve palsy, usually common foot drop, and then decreased absolute reflexes. Always check the reflexes, going to be decreased in this patient. Paresthesia, we talked about numbness, tingling, pain. Autonomic dysfunctions can happen. You can have low blood pressure, those kind of things. Okay, when you see that, mainly your examination and history will give you the diagnosis. The more diagnostic features, you do the lab LP, you can do nerve conduction studies, electromyography, and the treatment is very important. Get this patient to plasma exchange and immunoglobulin right away, my friend, so we don't miss this, okay? So remember, when we make mistakes, you have a lot of implications on our lives. So just be careful. That's why we're doing this kind of lectures and all that. We could end up lost. We could end up our whatever we earned in life could have gone, and our family is going to be affected. No money, no honey. Remember that. Your wife is going to leave. So keep watching us. Please subscribe to our channel. Thank you very much.